After Trump's executive order yesterday, will insurance companies still be required to cover the flu vaccine? They should be. So, yesterday, Trump signed an executive order that would cut the number of childhood vaccine recommendations down from 18 to 11. But his executive order doesn't really have the power to enforce those cuts. Those are decisions made by a vaccine advisory panel on the CDC, which is under Health and Human Services, which is led by Robert F. Kennedy Jr., a Trump administration appointee. Let's talk about what was in this executive order. The new order recommends that vaccines for COVID, notavirus, the flu, hepatitis A, hepatitis B, and bacterial meningitis be based on shared clinical decision making. Now, what that means is instead of it being universally required that children are vaccinated against the flu and hepatitis and bacterial meningitis, it'll now be up to the parents and their clinical provider whether or not they want to vaccinate their child against these diseases. Apologies for my mispronunciation. The executive order targets rotavirus, not notavirus. That's the intention of the executive order, but again, we're going to go back to the enforcement of it. In America, insurance companies decide what vaccines they're going to cover as a part of the price you pay that insurance company due to the recommendations of the federal government. Trump's executive order doesn't necessarily fall under the recommendations of the federal government that these insurance companies have to follow. That is the recommendation of the Advisory Committee on Immunization Practices. For the Advisory Committee to adopt these changes, they have to meet and issue out the rulings of their meetings. The problem is they haven't met in 2026. They were supposed to meet in March, but that was canceled due to litigation. They were supposed to meet in June, but that was canceled due to litigation. Now they're supposed to meet in October. The meeting is on the calendar. We'll see if it happens. What litigation is this referring to? You can read up on it, but essentially the American Academy of Pediatrics is taking Robert F. Kennedy Jr. and the Department of Health and Human Services to court over changes to the COVID-19 and routine vaccination recommendations, as well as Kennedy's choice to dismiss legacy members of this vaccine advisory panel. When it comes to your insurance coverage, particularly for children, at the moment this executive order was more symbolic than substantive, but I'll let you know if anything changes.